I'm Annette Pompa from the International Heart Spasms Alliance. We advocate for patients that experience angina with no obstructive coronary arteries, or ANOCA, and also non-obstructive coronary artery disease, or NOCAD. In part 1 of Sex Differences, we saw the research of Dr. Michel Corban on sex differences and microvascular disease parameters. This helped to show that men likely need different standards in testing, or they may be dismissed. If you haven't watched it, please do. In part 2 of Sex Differences, we are highlighting the male NOCAD patient. We will hear from 2 men sharing their experiences from seeking diagnosis to care. Their NOCAD endotype is coronary vasospasms. It's the same challenge as microvascular disease. Getting clinicians to look deeper on something that can be hard to see is tough when they're not looking for it. Although it is believed women deal more with ANOCA and NOCAD issues, they do not so far outweigh the men that we should falsely assure them or tell them they cannot have it. Men do have it. Remember, these are their own experiences, so it doesn't replace your journey of care or the advice of your doctor. But the stories are important. Let's take a listen. Here they are.
6 years ago, at the age of 41, I woke in the middle of the night with severe crushing chest pain, which radiated into my shoulder and down my left arm. Taken to hospital, test results came back as normal. We didn't know what it was. 2 months on, the same thing happened again, and they suspected it was anginal related chest pain I was having. I was referred to cardiology and put on anginal drugs, which really improved symptoms and the number of attacks I was having. 2 years on from that, I was diagnosed with coronary artery spasms after diagnosis through angiograms, ultrasound scans of the heart, and exercise testing as well. But during this time, there's been frequent visits to hospital. Often the symptoms are dismissed as being anxiety related, stress, even heartburn. But it also became apparent the more visits I had, a lot of doctors weren't familiar with this condition at all. And this is where I'd like to see more education in the syllabus for medical school for our new and up-and-coming doctors, but also in CPD or refresher training for existing doctors, which I think would have a far quicker impact on our care. Even going to the extent of health boards or healthcare providers having a set of guidelines for when their emergency departments see people with our condition coming in, what to test for, how to test for it, how to alleviate pain and symptoms. For me, that would be so helpful. There's nothing more stressful looking at a doctor getting stressed, not knowing what to do with you when you're not feeling too great yourself and wondering what's happening, if you are going to have an MI or not. So from that point of view, I would get rid of dismissal and hopefully lead to better management of a condition, better pain management, and in turn, hopefully a better lifestyle for us sufferers.
Hi, my name is Don Rahacek, and I have princemental angina. Prior to my diagnosis, I'd been fairly athletic all my life. I'd been a ski instructor, scuba dive master. I ran half marathons. In 2014, I completed Ironman Canada. But particularly as I was training for half Ironman and Ironman level competitions, I began having a lot of problems. Problems breathing, short of breath, chest pain, and wasn't sure what was going on. I was getting older, and so I chalked it up to that, and frankly, I chalked it up to the training that I was doing was quite extreme, and it's supposed to be difficult. In January of 2015, I moved to Denver, Colorado, and I had lived my entire life at sea level. And when I got to Denver, I immediately began to struggle. Mile high, the altitude was making a difference. And so for about 8 months, I was getting progressively sicker. I was having problems. I went from running a marathon in December to by June I couldn't run at all. I was in a gym trying to get in some kind of shape, knowing that I should have adjusted to the altitude by then. And in August of 2015, I showed some of my workout data to some colleagues of mine, one that was a former ER nurse and another that was a doctor, and they both told me I needed to get into a doctor's office immediately. So I did. That doctor took my symptoms very seriously, and as soon as he looked at my workout data from my Garmin watch, he let me know that I had some sort of significant cardiac issue and that significant testing would need to be done to try and determine what exactly the problems were. We did testing for about a week, ultimately ending with a 3D image of my heart. And I got a call about 9:30 at night letting me know that I had a significant birth defect. I had a myocardial bridge. It was several centimeters in length, and as far as depth, was about 2 millimeters from my heart chamber. And essentially all of the exercise that I had been doing had been collapsing my LAD, and that seemed to be the source of my issues. From there, I had to find a surgeon that could address the issue because it was getting quite serious at that point. I found a surgeon that was supposedly qualified, and I say that because he did do open heart surgery, but he did that without having done a heart catheter. And had he done that, we would have been able to determine that the surgery he did was the wrong surgery. Unfortunately, that surgery led me to contract MRSA. I had bilateral PEs. I had a TIA, and came very, very close to death as a result of the complications. Following recovery, I was better for a short period of time, and then I began deteriorating again over the next several months, to the point that I had to go out on disability from work. And by it was August or September of 2016, I needed a cane or a walker to move around, and was scheduled for another open heart surgery at the Texas Heart Clinic. When I went down there and the doctors found out that I had not had a heart cath done prior to my first surgery, they actually canceled my next open heart surgery until more could be done. And that is where the princemetal angina was diagnosed. They sent me to a doctor, cardiologist, who determined to do a challenge test. And so it was a teaching hospital, so we went in. The room was filled with doctors and nurses, elbow to elbow. And when they injected the acetylcholine, one of the doctors in the room actually blurted out, "Holy shit, did you just see that?" The acetylcholine had caused a 100% occlusion of my LAD and 80 and 90% occlusions in other spaces. And that was a completely new diagnosis for me, and it had never been discussed before. The positive piece for me was that I had some diagnoses. They felt that we could work around with medications. Unfortunately, that didn't end up being the case completely, because the issue with the myocardial bridge continued to cause more problems, and I struggled with the medications. And I should say, There were some very good doctors along the way that helped me, that believed me. I was fortunate as a patient that I was going from an Ironman triathlete to walking with a cane and a walker. And I can't imagine how many other people have conditions that have prevented them from being athletic. A challenge I run into with doctors is when they look at me having gained significant weight, they look at the weight as the cause of the condition rather than condition as cause of the weight. And so I have been with doctors that have been very judgmental. As a result of that, I have had doctors that have been very dismissive because they'll insist if something doesn't show up on an EKG, it doesn't exist. I had one cardiologist in particular that I got into a heated conversation, shall we say, because I had to explain to him the difference between a plumbing problem and an electrical problem. And he was wrong and I was right. I ultimately ended up in 2019 at the Mayo Clinic having an unroofing procedure done and having the bypass that had originally been done taken off. It had shriveled within apparently a few weeks of the initial surgery. And I recovered a fair amount after that, but I still struggled and still struggle with the Prince metal angina. Two drugs that we had. The first drug, and you have to forgive me, I can't recall the name of it, but it actually made my condition worse rather than better. I was on isosorbide mononitrate, and that helped, but I was still in the hospital with spasms on a regular basis on that medication. And I want to take a side note, a quick side note on some of the issues that occurred within the ERs as I was going through all of this. Every time I went into the ER for spasms, the doctors would want to give me pain medications, and they would go between Dilaudid, morphine, and there was a third one of the opioids. But every time I came in, I knew that what I needed was an IV drip, a nitro drip, and they insisted I had to take the pain medications first every single time. And lo and behold, as the opioid crisis started, they brought in some consulting firm for themselves and a couple other hospitals to do some studies, and they red flagged everybody that had come in and received pain medications on a repeated basis coming into the hospital. And so finally reached a point where I went in to get treatment. And I told him, I said, you guys are obviously going to want to give me pain meds. I don't want it. I want my IV nitro, but do whatever you need to do. Well, they had flagged me in their system as drug seeking, which was absolutely not the case. And they refused treatment. They stuck me in a room by myself and let me suffer without IV nitro for, I believe it was about 4 hours, until I finally crawled out of the ER, found somebody who got me a wheelchair and wheeled me over to my doctor's office that, thank goodness, was attached to the hospital. And he lit them up because they were the cause of that. And so when we look at how doctors and ERs and hospitals are treating people, it was a really lousy experience having to go through that and try and prove that it was their cause, not mine, as to why I was coming in every time. So I was a little off track, but doctors and nurses in the hospitals need to understand this disease, and I think it goes under and undiagnosed because of ignorance, just a lack of knowledge about it, or a lack of caring. I don't know. I got so sick that when I went to the Mayo Clinic prior to my last open heart surgery, they actually tried to talk me out of a heart catheter because they were afraid I was going to code on the table, and I came very, very close to doing that. They ended up, it was supposed to be a 2.5 hour procedure, and they finished within 12 minutes because I was getting too close to dying. But they got what they needed to prove that there was a significant issue that needed to be dealt with surgically, and they did. I continued after that last surgery to struggle with Prince metal angina attacks and continued to be in and out of the hospital. I had heard from another member of our Prince metal angina Facebook group that Cialis was a viable option for those of us that were struggling with the two normal medications for this. And it took me months of working with my doctors, convincing them that there was a need for this to get a prescription. And I finally did. And then I got the rude awakening of that medication and the cost of that medication when I went to Walgreens, which is where I have my prescription plan. And the cost for my medication for 90 days was going to be $14,500. Nobody can afford that. Elon Musk can afford it. No normal person can possibly afford that. And so I continued with the isosorbide mononitrate because I couldn't get the medication I needed. One day I happened to be watching television and I saw a commercial for GoodRx and popped up to see if there any possibility, because I needed 40 milligrams of Cialis a day for my condition. And what do you know, Costco would sell it to me for, I pay $56 for a 90-day supply versus $14,500 for a 90-day supply. And obviously just it's unconscionable that we have to go through this, but that's an issue out there, and so part of this is making sure that doctors understand that there are options for their patients, and for patients to understand that they have options in terms of their medication. I went on that Cialis roughly 2 years ago, I think just over 2 years ago. I have only been hospitalized once over those 2 years. I would normally be in the hospital at a minimum once every 60 days and frequently a couple times a month. And so to only be hospitalized once in 2 years is pretty remarkable and speaks to what Cialis is able to do for patients like me that do not react well to the other medications. It also begs the question of how much better quality of life could people have if they had affordable access to Cialis as a treatment for principal angina and spasms. I'm going through some questions here, and I want to make sure I touch on as much as I can. Getting advice on what to avoid, how to manage it, has been difficult, and that goes along with some ignorance and lack of knowledge. And I don't mean ignorance in a negative way, just a lack of knowledge that so many people within the medical field have about this disease. I was fortunate. I had a teleconference with a doctor out of Florida that gave me some advice, but quite honestly, some of the best things I've learned about managing my symptoms, I've had to learn the hard way through hospitalizations, and I learned to look for potential triggers. And the biggest one that I found that nobody else had seemed to pay attention to was around air quality and air quality management. And I discovered that on a fluke. My son had wanted to go out to grab some lunch. I was fine. We walked out, walked into the garage, hopped in the car, drove off. And by the time I got to the door of the sandwich joint, I needed an ambulance, and I had to get straight to the hospital for an attack. The following day, I found out that Denver's air quality was worse than Beijing because of forest fires. And I started going back and tracking and found that air quality is a major trigger for me. And so, again, things that, loud noises are a trigger for me. For instance, sirens that may come on unexpectedly, or a child screaming out of the blue. Loud noises can trigger spasms for me. And so I do everything I can to try and avoid those things. But unfortunately, a lot of it's just been learning it on my own, or again, through the shared group of people that have principal angina. And that's helped. The last thing, I'll touch a couple quick things here. In terms of what cardiologists and what they can do, it's learning more about this. Again, I go back to something I said at the beginning of this, which is a lack of knowledge and this belief that EKGs tell you everything you need to know. It's just wrong. And I was at a couple of teaching hospitals. I worked with residents on a regular. It was very common with my condition because it's so rarely diagnosed and diagnosed clearly. that I was always real popular on rounds particularly with the newer doctors, and so I would talk to them about needing to understand that these spasms don't show up on an EKG, yet they're real. And I carry pictures on my iPad and my phone so I can show them what my heart looks like normally and what it looks like under spasm, so that they will take it seriously. And so it's getting this out there. You just wonder and shake your head at how many people are going undiagnosed and what could be done to diagnose them better. It's a condition that gets masked because of other things that come along. In my case, myocardial bridge. Post my last open heart, I developed, I think it's either 9 or 10 different electrical issues that we have to deal with now with a pacemaker and medications. And so there's a lot that goes along with it. But missing it, I mean, I was so close to dying so many times. And those doctors took it seriously, but not all did. I had a doctor tell me at one point that I just had heartburn and I needed to take antacids. Even when he had the test results in his hands available, he had already made his decision and he just wasn't going to listen. And in some cases, it's human nature for some people, but the more we can get out there, particularly in med school and early on, and get people taking this disease seriously and understanding the problems that this creates for people and the risks that it poses for us. I ended up in some very dark places because of the disease, because of some of the doctors. I had doctors that I had an entire cardiology firm that offered me a wheelchair to finish my life. I'm too young for that. And I needed doctors that were going to fight. When I was at the Mayo Clinic and my doctor wanted to talk me out of getting my heart cath, I knew the danger going into that procedure. I knew there was a good chance I wasn't coming out of there alive. But I'm a fighter. And I expect the people around me to fight with me and for me. And if they can't do that, I don't need them. I don't need them there. If there's one thing I could say to every cardiologist coming out of medical school, that would probably be it. Fight for me, fight for us, fight for your patients. Don't give up. It's already hard enough on us as it is. We need you to listen. We need you to take us seriously. It's okay to say, I don't know, but try and find out. Life is too short and it's too precious to suffer needlessly. And I just hope more can and will be done. And if I can help in any way, I'm happy to do it. Again, I know I'm the rare exception on this one because my doctors made it very clear that had I not been in the kind of shape that I was in going into this, I would not be alive today. If I'd had any other contributing factors, anything, I would be dead. I know that. My family knows that. But I don't need a cane anymore. I don't need a walker anymore. I'm not able to go back to work. I sold my house and left the altitude, but I'm finding a way to live the life that I can live with this disease. And that's all that's the best any of us could ask for. So I know this is long. I apologize for that. I hope it helps in some way. And if there's anything else I can do to help in any way, I'm here to do that. Thank you so much.